Get that number happening. Free consultation, by the way, and on the air here once again at 12:03 on a Saturday afternoon. Would love to hear from you. 416-870-6400 star 640 on cell. You have pain concerns, health concerns. Dr. Lou is here for the hour talking to you about all that stuff, so feel free to call through and get some help, some opinion, some commentary. What's up, pal?
Not too much.
Good. How was the week? Week that was.
Very good. Seen an influx of headaches for sure in the last little bit. I've noticed that whenever seasons change for whatever reason,
Right.
I guess people get out there doing different things, or the temperature itself leads to new headaches or worsening headaches. And so people obviously want to figure out what's going on. And, again, we've gone through this quite a bit. When you look at headaches, you're overall looking at two broad classes. You're looking at the stuff that we would term benign. It's just a headache that happens for whatever number of reasons, or malignant type of headaches that could be related to, a tumor or something very serious, something that's pathological. So step one is always trying to figure out which one of those two it is. Different signs and symptoms will definitely point you in different directions. Red flags are something that we'll look for that would constitute something that we would worry about. So things, if people ever say the worst headache they've ever had, or that it's associated with a lot of other different types of signs and symptoms, or if they have other more serious constitutional signs and symptoms going on, like constant fevers or significant weight loss or very bad night sweats or extreme pain. Those are all things that'll start to tip us off towards something that's potentially much worse. But by and large, the vast majority of headaches are obviously benign, and they fall under the things that are related more to tension in the neck, which we would term tension headaches, or cervicogenic, which means arising from the joints of the neck. You can get cluster headaches and migraines, which are, again, there's a musculoskeletal component for sure. But, there is some good research to suggest that migraines may be related more to vascular flow. In my experience, no matter when you're dealing with the benign types of headaches anyways, you always do have some type of a musculoskeletal component going on. And what I mean by that is that there's some type of compounding effect by the muscles and joints in the upper back, the neck, just because, again, based on the world that we live in and the things that we do, everything is in front of us, whether it's us eating, driving, at a computer, everyone's work. I can't even really think of anyone's work that wouldn't be there. So, you're going to start to create tension in the upper back, the neck, and a lot of those structures that come out of the neck go into the head, and they can cause referral type of pains and things like that. So it's very, very important. Now, the key becomes, once you're able to figure out, okay, what type of a headache is this? Obviously, what most people want to know is, okay, well, what do I do to get better? Yeah. And so, that's exactly it. The biggest thing is trying to figure out the triggers of those headaches. And then once you can understand the triggers, well, then you can do the right things to treat the headache. So, it could be something as simple as you identify that having wine, for example, gives you headaches. Now you can make an educated decision. Do I want to have wine and potentially get a headache? Or it could be other things like, I know that if I go golfing, if I do more than 2 or 3 rounds a week, if you're so lucky to do so, that, maybe the muscles get really tense and you get headaches. And so then maybe, having a good therapist part of your healthcare team, someone that can work on those things, is the key. So there's different ways, but again, it's all about the person being able, and the practitioner being able, to identify what are these triggering factors of these headaches, so that, again, you can treat it based on what's occurring. And again, my biggest thing that I always say, and it's so often misunderstood with everybody that comes, not everybody, but the vast majority of people, it's always like, well, what can I do for this? And it's like, we need to figure it out first, right? And I can't stress enough how important it is to have the right diagnosis in order to have the right treatment. Because if you don't have the right diagnosis, treatment is based on a diagnosis. Sure. If you have the wrong diagnosis, you are inherently likely going to be doing the wrong treatment intervention, and therefore you don't get better. So I would always be, and I don't expect the average person to understand this, but definitely I would always be hesitant that if someone just jumps to a treatment option without looking at what the potential causes, because, there's a lot of fads out there where it's like, oh, for, neck pain, do this. Well, not all neck pain is created equally, and it's not all related to the same thing. So that new fad may be really great for a certain specific type of neck pain, but not necessarily all neck pain.
416-870-6400 star 640 on cell. Open lines. Would love to talk to you over the next hour. Chris in Mississauga, opening call. How are you?
Hey, Dr. Lou, thanks for taking my call.
No problem.
What's going on with you, man?
Okay, as I get a little bit older, like just went into my 40s, I'm noticing pain, like or nerves, like moving around my body. Like I had one in the loin, that went away, and then I had tennis elbow, that went away. And I'm a very fit guy, work out a lot, run. And the latest one I have right now got me a little bit concerned is when I turn my neck to the right, my chin to the right, I'm feeling like this kind of pinched nerve in my upper right shoulder where my shoulder maybe meets my collarbone.
Okay. Yeah.
You understand?
Yeah. I get
just a twinge, and I notice it dives down in terms of intensity. But then I'll go and work out, and it comes back, and I notice it when I'm sleeping. If I, turn, put my head on the pillow a certain way. So I'm just wondering if that's something that hopefully was just passing, like some of the other things I've experienced, or...
So what type of working out, Chris, do you do? Do you like big weightlifter type of guy? Would you explain that a little to me?
Yeah, I definitely lift heavy weights a lot, and then I work in construction.
Right, so I mean, the reality is that as you get older, wear and tear of the body, I mean, you could grab a person who does nothing their whole life, and, just because they live a longer period of time, every year their body will break down a little bit more. That's just the natural aging process. That's why eventually we die, because our body just can't sustain itself forever. But definitely once you start adding in other factors, other things that maybe help the breakdown or expedite it. See, the thing about the type of stuff that you're doing, and I would never say to someone, don't work out, don't do things. Yeah. But we do have to realize that when you're lifting heavy weights, you're doing that type of stuff, you're working construction, there is a certain amount of demand that's placed on the body. And if you've ever looked at what's called the stress curve, when you look at the stress curve that applies, whether it's psychological stress or physical stress, such as that you're going under, there's a moderate level that tends to be beneficial for us and really makes us perform better. But if you're too low on the stress, then that's not good. But equally, if you're too much, that's potentially dangerous. So again, over the airwaves, it's hard to say exactly what's going on with you, Chris. But definitely what I can tell you is that it's not uncommon for people who are extremely active, by their choice with the things that they do, like such as yourself with lifting weights, and then also with related to work with construction, that there is significant breakdown. Now, does that mean that you have to stop doing the things that you love doing? No, absolutely not. It just means you may need to take better care of it. And that's why, different professions such as chiropractic, massage therapy, physiotherapy exist. It's really to help with those things. And, what you said there about sometimes, the other things pass and go away. I would caution you to understand that things don't often go away forever. They may go away for a period of time. But, you're only 40. What happens at 50? What happens at 60? And, that's kind of the dangerous thing where you just let these things pass on their own. Your body doesn't have the best way. It's very good in terms of keeping itself safe, but not for a long term, because we weren't designed for that. So when things heal, they often heal in a faulty way for a long-term perspective. They're very good for the short-term perspective, but the breakdown that happens as we continue to get older, as you continue to do the things that you do, are things that maybe you should consider having a good therapy team with you to help you through these things. That also, in turn, will get you educated about what's going on. And when you're educated about it, again, you can make the right choices on what I should or should not do.
I see. Okay. Realistically, I'm the kind of guy I really don't get to the doctor too much. I don't get to these experts too much. I don't know how realistic that would be for me to do that, but is there any way that...
Well, Chris, I think we're going to go on a break. Why don't you just hang tight?
Hang on to you.
Yeah, and we'll keep talking about this when we get back.
Don't go anywhere, Chris. Everyone else, 416-870-6400, star 640 on sale. You got some concerns, some pains. Bring it on. Dr. Lou is here till 1 o'clock. The Dr. Payne Show, Talk Radio. AM 640. Yeah, plenty of time to call that number here at 12:15 till 1 o'clock. Dr. Lou is here. By the way, info at paincarecanada.com or 1-855-55 Lou, DRLOU. Free consultation, and simply Dr. Lou on social media as well. Twitter, Facebook, Snapchat. I don't know Snapchat probably, Snapchat, but LinkedIn for sure.
Yep.
You on Tinder?
No.
Different topic. Chris, how you doing, buddy? We're back. Yeah.
Hey, thanks for holding on. I had one more question, just about myself.
Sure.
working out, I'm not sure I could ever stop. Like it's my
No, and I'm not suggesting that either.
Yeah, like when I do it, it makes me feel alive. It gets my blood flowing.
Yep.
So, is there any way, like, have you ever heard of anybody ever exacerbating, like, muscles I can understand, like, bone I can understand, but nerves? Like, is there any way that I could tweak this nerve where I may, possibly do some damage to my arm?
100%, yeah, for sure. And nerves are much worse. See, the reason why I wanted to keep you on the line is because I think you said something that's very important that relates to a lot of people in the population, where you said you're not really the type of guy that'll, involve the healthcare professionals, and you kind of want to deal with this stuff on your own. The one thing that I could tell you is that as time goes on,
you will be.
You'll have no choice. And as time goes on, and when involving them becomes less of your choice, is usually when things have become much worse, that they're much harder to deal with. So, and that's a personal choice, and I'm not here to force anybody to do anything. And again, another point is I would never discourage you from working out. I think that's great, and I think people should do the things that, keep them active in life. But what I am suggesting is that, this phobia, or whatever you want to call it, that you and other people have about, I don't want to involve the healthcare professionals. They're there for a reason. And that reason is because when you involve them when things are low level like this, that's when you prevent the bigger things from happening. Because again, it's like John just said, they're lurking there. They're waiting that, eventually one day something something may happen that's much, much worse. And, I see all kinds of people in practice. I see the people who are proactive, and they come in, and I'll tell you that the people that are proactive, that are coming in when things are small or almost non-existent, are the people with great outcomes that do much better long term, versus the people who come in because they have to come in at this point. They don't have a choice anymore. Those are the people that have the worst outcomes because they've let something get so bad. So my point is always, again, and you may say that I'm biased because I'm a healthcare professional myself, and I'll accept that. I'll accept that bias. But I do truly believe that it is very, very important to have a good healthcare team around you that helps you deal with these things, although they may seem minuscule. The unfortunate reality is that as we get older, as time goes on, we are just more and more likely to experience those low-level things.
Mm-hmm. I think actually you're getting through to me.
Okay.
For something like nerves, like what would be the more specific expert to go to? Chiropractor or like
again, it depends. So to just say a nerve issue is non-specific. We'd have to figure out what it is. This is, the point here, Chris. Come see me. You can actually see me. I'll do an assessment. We'll figure out what's going on, and then I can recommend the right professionals that can help you manage your issue long term.
Chris, it's 1-855-55 Lou DRLOU, or info@paincarecanada.com. It's like we've often said before. You change your oil in your car periodically before you blow the whole engine from ignoring it. Right? Just maintenance is cheaper than repairs. You got
100%.
Right?
And when you look at, as 20, 30 years ago, there was definitely this idea that one day we would find this magical pill that would cure all things.
No.
And as time goes on, we're starting to quickly realize that's probably not likely. And where we're going to get our biggest bang for our buck is prevention. How do you do the right things? And it's not overly complicated either. Exercising at a moderate intensity, because again, we do have to understand that anything that you do too much of also becomes dangerous. Even although it may seem good, we'll take for the example running there is research to suggest that moderate level cardiovascular activity actually increases longevity and is better for your health. But if you start going to the extremes, that's potentially just as dangerous as not doing anything at all. So exercise is very important. Eating healthy, and eating healthy is not rocket science. It's a lot of things: fruits, vegetables, the things that are alive, and diminish the meats, and very much diminish the things that are processed and made in a factory. And again, using the experts that are out there from a preventative standpoint. Don't just go there when it's too late, because that's often when the least can be done.
Alex, we'll get to you quickly before a break. What's going on with you? Hey, Alex.
Hey, how are you?
Good. What's your concern, pal?
Quick question. I'm a 47-year-old, fairly fit male. Did some working out. Went pushed through a tennis elbow injury, and now have a 2-centimeter torn extensor tendon. Going to see a specialist at some point soon. I was curious about what the likelihood is of a full recovery and being able to do light to medium weights after the procedure, if there is one.
Right. So just before we go on that topic, it's a perfect segue, into what,
follow up anyway.
Follow up to what we were just talking about, which that when you leave something that seems minor, they could progress to much worse. Have you seen a surgeon yet, Alex?
No, I've had an MRI and a couple X-rays, and that's confirmed the tear in the tendon.
Okay.
So I've just been waiting quite long to see someone, but should be seeing someone fairly shortly. But I anticipate either surgery or...
I lost you there.
Sorry, say it again, Alex. You anticipate what? Surgery?
I think his point that he's trying to get across to, because I think we've lost him here, is, with the surgery, what he should be anticipating and then what his recovery will be like. And, that really depends on a lot of things when you look at tears, exactly where they are, the extent of the deficits that he has now from a clinical exam, right, from a range of motion perspective, become very, very important. And that all will point towards the prognosis. But, if all else being equal and the surgery goes well, a full recovery would likely be expected. Does that mean that he'll never have pain? Probably not. But he should, again, have the function of that tendon, which is to hold things in place.
Have questions, concerns, pain, headaches, whatever, bring it on. We'd love to talk to you. 416-870-6400 *640 on cell. Dr. Payne Show continues. Talk Radio, AM 640. 1225 Dr. Payne Show. Yeah, any sort of pain, man. You got back, headache. We talk about it all here. Dr. Lou here, ready to take your calls and concerns, give you some answers, put you on the right track. 416-870-6400 *640 on cell. Ali, how are you?
Good. How are you, sir?
Good, man. What's going on with you?
Well, I have a pain in my right side back. It's going down my legs. This was about almost going on to 10 years now. And I took physiotherapy for about a year. It helped. But at the same time, I've been getting this pain on and off again. I had a very good sports medicine doctor who had recommended surgery. But he told me if I took the surgery, there was a chance I might not walk again. He might hit the wrong nerve or something like that.
That's a significant risk.
Big time.
Yeah. So what is it really? He's saying that the disc is pressing against the nerve.
Right, okay.
You have to clean the disc or scrape the disc off a little bit.
Right.
But when I take the therapy, I go for the physio. They put me on this, the traction.
Yep.
And all of that. And I take this. When they put a little machine on your back and it sends that current inside.
Yeah, the IFC or TENS machine, yep.
Yeah, it helps. It goes away for a few months, but it comes right back.
Okay.
My job, I'm a driving instructor, so I sit a lot all day.
Yep.
So I was wondering if, at this age, if I take the surgery, will it help me? Or should I continue with the physio?
Well, that's a very, very specific question, and I would obviously need to assess you to be 100% sure, or at least give you a good opinion on that. What I can tell you is that, number one, if we do assume it's a herniated disc, and second, if we assume it's the most common type of herniated disc, which is a posterior lateral, which means it usually affects one leg, what I can tell you is that sitting is potentially the worst thing that you could do for that type of injury. Now, it sounds like, you've done a lot of therapy. Have you done any rehabilitation where you've built up the muscles in your core, your glutes, and in your back?
No, just regular, just some exercises.
No, yeah. So really, and again, this is where what we see on imaging has to correlate very well with what we see on a physical exam. And there's a lot of failed surgeries out there for this type of stuff, because the reality is when we look at chronic low back pain, what we find tends to be the most important thing to getting better is proper rehabilitation of the core musculature, which includes the abdomen, the back, and the glutes, as high as even into your shoulder blades. And in the absence of doing the right rehabilitation, it's not uncommon to hear the type of story that you're telling us, which is that you have pain that comes and goes. It seems to be better sometimes it gets aggravated. You do some therapy. That's just the reality. But the one thing that you're missing is the proper rehabilitation, building up the muscles in that area to keep your back healthy.
Yeah, it's mostly on my right side also.
Yep. Yeah, it does. Well, that just means that's the, whether it's on the right, on both sides, again, with chronic low back pain, and I'd also, the other thing that I'd say is I'd be very surprised that a surgeon, having said that, with the low back, the risks are much, much less risky than it is for, say, something like the neck. But in the absence of a neurological impairment and in the absence of range of motion or objective findings that suggest that this is diminishing your function, I don't know that a surgeon would necessarily operate for sure. So, I would think that based on what I'm hearing, that probably doing proper rehabilitation is your best bet. But if you want to be sure, come see me. Let's do an assessment, and that's really the only way we'll know for sure what my real recommendation could be.
416-870-6400 star 640 on cell. More of your calls coming up here at Dr. Payne Show. Talk Radio, AM 640. And Dr. Lou on social media as well. Just to follow up what Ali was saying there about potential surgery. You quite often say, in fact, you always say that just because a surgery might be involved, don't expect to be completely pain-free as a result of that surgery, right? And that's what some people are hoping for.
Yeah, so again, when you have problems, that are related to function. So let's take, for example, not the back, but let's look, say, at the shoulder. You have a shoulder that repeatedly dislocates, okay? That means that no matter what you're doing, unfortunately, your shoulder seems to dislocate. You can almost do all the therapy in the world, and it's not going to solve your problem. But you can get a surgeon who's going to cut those tendons a little bit shoulder, slap them in a little bit tighter. You're going to lose range of motion, but your shoulder's not going to dislocate, which, is probably better than having your shoulder dislocate just by, picking up your kid or playing or whatever. So, when surgery is very much for the function of things, the outcomes tend to be much better. So if you're someone who's a candidate for surgery, really try to focus on what's my improvement in function going to be versus pain levels. Because again, pain is so complex and it's made up of so many different things and it's so subjective that it would almost be impossible for us to ever quantify, does this surgery always help with this type of pain? Because people's pain levels are different.
416-870-6400 star 640 on cell. Would love to talk to you right till 1 o'clock today. Joey, how you doing?
Not bad, you?
Good. What's your concern?
So I'm younger. I'm only 21, and I try to work out 5 to 6 times a week. And for the past maybe year and a half, I had a pain in my elbow that, I don't know much about this stuff, but if you feel your elbow on the inside, that little crescent that it has, I don't know. Well, in between there, it's a sharp pain that whether I'm at the grocery store holding a basket with little to nothing in it, I have to drop the basket out of nowhere. If I do a slight bend, it's a sharp pain that I can't hold weight that's 5 pounds maybe. Or it happens in the gym while holding a dumbbell, for example. It's just I can't bend my elbow until I let go of that pain.
Yeah, so again, what we have to do at this point is you have to look at that anatomical part of the body, so your elbow, like you're saying, and now we have to look at what are the structures in that area. There's muscles, there's ligaments, there's tendons, and there's nerves. And it could be any one of those things potentially causing that type of a presentation. The next thing we have to do is also look up at the other areas that correspond to that, so the shoulder and the neck. Could it potentially be something like a nerve being pinched at the neck or in the shoulder somewhere that when you're doing some type of lifting is putting pressure and you just tend to feel it in that area? So this is where getting a proper assessment is so very important because you're able to actually identify what's the pain generating structure. And anybody that listens to the show will have heard me say that a lot. What's the pain generating structure? And that's what we have to figure out is what exactly accounts for the pain that you're feeling. And once we can figure out, okay, what is it that's causing your issue? Well, then that's when treatment options are obviously easier to outline for the person. Yeah. So, based on whenever you say something like weakness and things like that, my head starts to go towards nerve for sure. Having said that, in the elbow, you can have in that area like a severe tendonitis of the biceps tendon or a tear of it that may be causing the same presentation. So there's a lot of I shouldn't say a lot, but there are definitely half a dozen to a dozen different things that could be causing what you're feeling. And the first step is figuring out exactly which one of those things it is in order to get you on the road to recovery. Yeah. Make sense?
Yeah, perfect.
Okay.
I just procrastinate. But thank you so much.
Give us a call. We can take a look at it.
1-855-55 Dr. Lou, DRLOU. There, Joey, or info@paincarecanada.com. It's complex, but it just takes steps, right?
It takes steps, and this is the thing. Everybody they feel an ache or a pain, and it's not even their fault. This is just the way we're sociologically brought up. Like when you're a kid, you fall, you bang something, just walk away, it'll be better. And, the body, again, does do a tremendous job at healing for the short term. It also does a much better job at healing when we're younger. But, after the age of 23, 24-ish, our bodies aren't so good at healing anymore, and they still will heal for the short term, but they're not necessarily built to heal for 25, 30 years later, because from an evolutionary perspective, that's not what we were designed for. If you tore a muscle slightly, it just basically had to get repaired to the point that, within a short period of time, if someone was attacking you or something was attacking you, you could get away. But the reality is that, we live a much longer time now on average as humans, and these things are bound to get worse as time goes on, and these little low level aches and pains are really the ones that we ignore them, but these are the ones that we should be taking care of, because if you take care of them now, well, then they potentially may never become a massive issue. Now, does that mean I can guarantee that if you take care of a small problem today, that in 20 years it won't be a big problem? No, of course not. No one would be able to guarantee that, but definitely being somewhat proactive this doesn't mean that you wake up, you feel a pain, and you're like, that's it, I'm going to get this,
I'm done.
But, if it's gone on for, 3-4 days, or it's happened now multiple times, then, maybe it's time to get it looked at before it becomes severe. A lot of times it's just something that affects more quality than it does anything else, and it doesn't necessarily hinder function or anything like that, and so we often ignore it. So, I think it is very, very important that people, start to take a little bit more responsibility for their health in that regard, where, if you are feeling something, being that person that you're going to take care of it on your own. And it's not uncommon. We hear it all the time. What can I do for? What can I just do at home? And everybody's looking for that quick fix. And the unfortunate reality is that quick fix for a lot of these issues for pain management doesn't always exist. Now, there may be things that you can do at home as well, for sure, but it may not necessarily be the be-all, end-all of your treatment plan. This is where involving professionals is very, very important. And I guess, more important than that is involving the right professionals. Right. And, that's why we're here, is to have a team that of right professionals. And no matter where you're listening from, I can't be everywhere, but I definitely have a provider network that's vast and that can help people wherever they are, as long as it's something that can be helped with. And I'm very honest with people. I've had people that I've talked to or that have come in, and I see an issue, and some things just either go too long or just things that unfortunately can't be helped because of the limitations that we have in our system, and the knowledge that we have for healthcare. And I'm very honest. If someone has something that I think can't be helped, or that there's nothing else that my team could potentially offer, I'm going to be honest about that. There's no point in lying to anybody. So, I mean, it's absolutely free. Just give me a call and we can have a quick chat about it.
To get a hold of Dr. Lou outside of the show, reminder, 1-855-55-Dr. Lou, DRLOU. But to call in now, between now and 1 o'clock, we'd love to talk to you. We got open lines, 416-870-6400, star 640 on cell, the Dr. Payne Show, Talk Radio, AM 640. 1242, lots of time to talk to you. Yeah, 416-870-6400, star 640 on your cell. Paul, thanks for calling in. How are you?
Not too bad. Yourself?
Good. What's your concern?
First off, I want to say long-time listener, first-time caller.
Thanks, man.
Awesome.
My issue is, the best way I could describe it is when I'm, for example, just say I'm looking for something that's underneath my bed, and I'm stretching my neck and looking to the left, I feel a lock in pretty much the middle of my upper spine, my upper back.
Okay. Is that it?
I was wondering what that could be a cause of, or what the issue could be, or if there's anything I can, if it's something I need to have looked at.
So is this something that happens with any other type of activity, like, other things that you do during the day?
No, not too much. I'm pretty active. I'm a sports guy, so I'm constantly active. I go to the gym. It's just I find when I'm reaching my upper body and kind of looking down into the left, it kind of, I feel like the best way to describe it is like a lock.
Mm-hmm. Yeah, I mean, the good thing is when it's only one very specific event that causes the issue that you're having, the simplest answer is remove that one event, right? Stop reaching when you're laying down or whatever it is, and that may help to eliminate the issue. But yeah, is it something that you can get checked out? For sure. Sometimes things can start very minimally, such that you're describing, and then progress into other activities. So there may be a way to prevent that. We can't say for sure obviously without looking at it, but give us a call and we'll set something up. We'll take a look at it, and hopefully it's nothing to worry about. And if it's nothing to worry about, we probably will send you off with just some simple things that you can do on your own.
Perfect. Thanks a lot for the help.
No problem.
Thanks, Paul. See, it's like you said, the description's so key when you do that first initial assessment, right?
That's
you
it.
got to find out what's going on.
Yeah, and listen, the treatment is not always, okay, you have to take all this medication, you have to do injection surgery. But sometimes the recommendation is, here are like 3 or 4 very, very specific and good exercises that I want you to do. Or sometimes the recommendation is, maybe introducing this into your diet is going to help, or eliminating this from your diet, or, sometimes it's maybe a monthly massage or whatever. You can't always. Everybody's different. And so it really depends. And that's why I always go through, what have people already done? What seems to work? What seems to not work? Because that'll give you, we try to paint a treatment picture that is very specific to the individual.
416-870-6400 star 640 on cell. Alicia, good afternoon.
Hi.
How are you?
I'm fine. So I'm calling concerning my son. He's 26, and he's experiencing intense abdominal pain.
Okay.
He's seen a lot of specialists. He's taken, I would say, majority of the tests that's possible. Mm-hmm. And still they're not able to locate anything that's causing this pain. He's taking medication. The specific medication, I don't recall right now what's the name of it. When he takes it, it relieves his pain, but if he doesn't take the medication, it comes back. The pain, when he gets it, he feels like gagging, like he wants to throw up.
Okay.
So I don't know if you've ever came across with anybody with that kind of a problem.
Yeah, so where exactly in his abdomen is his pain?
It's on his right of his tummy.
The right lower or upper, like closer towards the chest, or lower down towards the groin? Lower down. Okay. So, one of the things when we look at abdominal pain, we divide the abdomen to 4 quadrants. Right and left, upper and lower quadrants. And that helps us to identify what important structures are in that area. So when you look at the right lower quadrant, it's mainly intestine, so there's not much else besides that. The appendix is also there. But, my assumption is that if this has been going on and he's had all the tests, they've already looked at all the possible, visceral. The reality is, when you're going to get this stuff checked out at emergency departments, walk-in clinics, family doctors, the right thing to do is to eliminate the potential that it's visceral, that it's being caused by an organ, something that could potentially be life-threatening. But that doesn't mean that there's no soft tissue like muscles there that, you in that area, it's not uncommon to have things like a sports hernia, which would be, some slight tearing of the abdominal wall that can mimic that type of pain. Now, that's a diagnosis of exclusion. You wouldn't want to jump to it and say, patient comes in on day 1, has lower abdominal pain, and you say, yeah, it's a sports hernia. You do want to make sure that everything else is fine, which it sounds like that's already been taken care of. But now that means that there's still the musculoskeletal stuff, which could be something like just, again, a simple sports hernia or a slight tearing in the abdominal wall that's creating that type of symptom. So at this point, if he's been checked out by the people that are very good at looking at the visceral concerns, now he needs to be checked by someone who's very good at looking at the musculoskeletal potentials of the pain in that area. And so that's definitely something we can help with. Give us a call, come on in, and we'll take a look at it.
416-870-6400 star 640 is the number. See, it's right there. You broke it down to 4 little areas and you go from there, right? Pain mimic, is that a huge thing? Is that tough to diagnose?
Absolutely. And again, when you have a patient, if you walked in right now and you had been nowhere else and you said to me, my chest hurts on the left side and it's radiating into my arm. Well, the first thing I'm going to worry about is this potentially some type of cardiovascular event, because there's a very, very important organ in that area that you're talking about.
You need it.
Exactly. It's kind of important. And so, but what ends up happening, does that mean that the only thing that causes chest pain and arm pain is a heart attack? No. Sometimes it's just a simple rib issue or a muscular issue. Right. But you need to rule out the most serious things first and then treat the things that are likely benign later once you've ruled it out.
Speaking of rib injuries, Irene, welcome to the show.
Hi there.
How are you?
Dr. Lou.
Hi.
I have a question with regards to an injury that I had several years ago.
Mm-hmm.
If I can just give you a little bit of background.
Go for it.
I lifted a rock, which was quite heavy. We were doing some construction around the house, and I felt something happening on the back, left side of my back,
okay,
the rib area. I felt like something had just bulged out, and the pain was excruciating.
Mm-hmm.
From that, I thought, well, the best thing to do is go see a chiropractor after a couple of days. And the chiropractor didn't really look at the bulge. Yeah, no problem, we'll do an adjustment. They did an adjustment, and the pain, while I was on his bed, the bed there, I cracked so much that he and I both thought that I wasn't going to be able to get off that table anymore.
Right, okay.
So he looked like he was stunned. As a result, I managed to get off that table, and I had to go on to some anti-inflammatories. I couldn't get out of bed. I was in spasm and really, really bad. After that, there was an x-ray taken, which detected that the rib had broken. So he basically, I think because the intercostal muscles were out, the compromising of the rib was cracked. The rib cracked because it was compromised.
Right.
So from then, the rib never healed properly because I think the muscles pushed it in a different direction than where it naturally would go.
Yep.
I still have a bit of that bulge. This is now 7-8 years later.
Mm-hmm.
I did go see somebody that said, well, we don't do much for ribs.
Right.
I'm still having that problem. I'm still going for massage. I'm still going for therapy. Sometimes from overworking it, I have a lot of pain. That rib still never went back in place.
Mm-hmm.
And I don't know what to do about it. I've been going for therapy now. It's like 8 years.
Yeah. So, I mean, we'd have to look at it. Do ribs necessarily, quote unquote, fall out of place? That's debatable. Is there sometimes a weakness in the muscles that surround the ribs that cause them to maybe move a little bit more than they should? That might be more likely. One of the risks of having your ribs manipulated is unfortunately a fracture. The risk of that is very, very mild. In fact, a lot of people that have rib issues that cause what's called a costovertebral joint dysfunction find tremendous relief from manipulation. So, unfortunately, you were on, one of the unlucky ones, which is very, very rare to have it fractured. But we'd have to identify, again, what is the original source of the problem. Sometimes people have, a slight scoliosis. And when you have a slight scoliosis, your vertebrae actually turn a little, and it may make it seem like that rib is out, but it's not out. It's just the natural rotation of the vertebrae, and that's how the rib will sit on the vertebrae. So no matter how much you try to push it in, you can't do that because you'd have to change the scoliosis in order to do that. So again, this is where trying to find the root cause is the most important part. But, come see me. Let's take a look at it because, there might be something that we could do. And if it's something that's unfortunately just related to the structure of your body, well, there may be exercises then that you can do to help relieve.
Irene, that number 1-855-55 Dr. Lou, DRLOU. Back to your phone calls, Dr. Payne Show, Talk Radio, AM 640. And right back to it. Try to get all your calls here the last few minutes. Myrna, hello.
Yeah.
Hi.
Okay, can I get that number again before 1-855?
55 Dr. Lou, DRLOU.
L-O.
Correct. 1-855-55 Dr. Lou.
We got a bunch of calls. What's your question?
L-U. Is that L-U?
L-O-U.
L-O-U. Okay.
Perfect.
Now, what I'm afraid is it has already affected my posture.
Okay.
So, but I thought I might better concentrate on doing it rehabilitation or...
Where's your pain?
Yeah, it's sometimes my back and near my neck is above just where my hairline, above my neck.
Okay. Yeah, so, skull pain related to neck and poor posture is very, very common. it affects a lot of people. I think the number is 80% of the population because of the things that we do. Does improving your posture potentially help with that stuff? Yes. But again, this is all kind of the same thing. I do have to look at it. I have to assess it in order to be sure. But yeah, you have the number. Give us a call.
Okay, so where are you located?
So I personally do the assessments out of Etobicoke, but we have a provider network throughout the whole, all of Ontario. So give me a call and we'll find someone close to home.
Hey, Neil, get you in quickly here before we wrap. What is going on? Hey, Neil.
Oh, man.
Oh, man. Neil.
Yeah.
Take me, brother. What do you got? What's your concern? You're on the air.
Just one motor, man.
Sorry?
Neil?
Was there like an aftermarket part or... No, you got it.
Carrasco show was 2 hours ago.
Carrasco show, yeah.
Neil, you still there, brother?
Yeah. This was my biscuit coupling thing. I couldn't go anywhere else. There's no aftermarket part. I had to go.
See, I hate that when there's no aftermarket parts. It's the worst, especially for your back.
I don't understand people. It's like, pay attention to what you're doing, and then you wonder why you live in pain. You may be the source.
I mean, if you're ordering a coffee into the drive-thru, that I understand completely.
That was a classic. That was
brake
a classic
pads
one.
not happening.
Yeah, I think I guess based on the show that we've had, the big common thing here is get this stuff checked out. Come see me. Like it really is going to cost nothing. Literally $0 to call 1-855-55 Dr. Lou. Leave me a voicemail. Hit option 2. Just give me your name, your number, and a quick description because I'm going to talk to you anyway. So just tell me low back pain or elbow pain. I'll call you. We're going to have a discussion. If it's something that I do truly believe that I can help with, then I'll get you to come in. We'll do an assessment. If it's something that I think somewhere else might be better suited to help you, then we'll go in that direction. Done. But it's very, very simple. And a lot of people, there's a lot of issues out there that are being mismanaged, whether it's something new or you're already seeing somebody but aren't sure, need a second opinion. That's what people are coming in for. And I'm very, very busy with this stuff. I love to do it. And I do truly want to try to help people with their pain management for sure.
Till next weekend, we are done. That phone number, 1-855-55 Dr. Lou, DRLOU, or info@paincarecanada.com. It's Dr. Lou on social media as well. Get that free consultation happening. Take care of it. Get on top of it. Back here next Saturday, Dr. Payne Show, Talk Radio, AM 640.